So now everything is open and live. And so as people start coming through, good morning. Hello, everybody. Welcome. We are just getting started. So as you arrive into the webinar, I'll just get you guys to draw your attention down to the bottom of the screen. There's a chat and a question answer section there. Just pop into the chat and say hello. And then I will go through a little bit as people start funneling through. So we've got Pam with us from the Workplace Safety and Prevention Services today. She's joined us. My name is Elise. I work for TCC Canada, and we are an A to Z business solution provider. So what we do is we offer shared office spaces such as co-working, permanent office spaces, as well as virtual offices. So if you just need a business address or whatnot, we've got those as well. So we've been throughout the pandemic trying to bring on experts in different areas of the field so that they can help support our community as much as possible. And Pam and the Workplace Safety Prevention Services have been so generous to be able to join us today. We felt like this is a really good topic for businesses that are looking at returning back to work now. There's a lot going on. There's a lot of information coming back in. So yeah, so I'll pass it over to Pam and we will get started.
Terrific. Thank you very much. So good morning, everyone, and happy day, and hopefully there's some sun for you today. So my name is Pam Patry, and I am a health and safety consultant with Workplace Safety and Prevention Services. We are one of 4 health and safety associations in Ontario, and today we're going to talk about safety insights for getting your business back to work during COVID-19. So I want to start by just saying to you that the information that I'm providing you today is current as of what we know today with COVID-19 and with legislation in Ontario. But I think that it's really important I just want to mention to you that this is changing very quickly. And so at the end of the presentation, I'm going to provide you some resources that you really should look to follow and get updates on. We know that changes are coming every single day, and we just want to make sure that you have the most current information. Today's presentation is based on what we know as of now, and just make sure that you're following up to see what's changing and what's new as we progress through COVID-19. So Workplace Safety and Prevention Services is a nonprofit organization in Ontario, and our mission is every worker healthy and safe every day. Every single day, every worker should be able to go home the same way they went to work. And so we are very proud of the work that we do in health and safety, and we're a proud partner in the Ontario Occupational Health and Safety System. So we do work with WSIB and Ministry of Labor, Training and Skills Development as we put together our information and make sure that we are able to provide the safety knowledge that you need to get back to work. Other things that we do as health and safety experts is consulting and training and providing resources to our community about health and safety. So for today's agenda, we're going to look at some insights into safety issues that are being found out because of the pandemic. We have learned many things over the last couple months, and we want to share with you that knowledge. I'm going to provide some recommendations for safe work practices to keep your staff safe and the public safe while working during COVID-19. And then we will look to see if there's any questions that come up in the chat box that I'll be able to answer at that time as well. So it doesn't matter what your hazard is. At the end of the day, we need to recognize the hazard, assess, control, and evaluate the controls we put into place to ensure that our workers are safe. So we're going to talk about the RACE process today as it relates to COVID-19. So COVID-19 is a virus that's causing an outbreak in respiratory diseases, and it ranges in severity. So this is a biological hazard when we talk about the hazard wheel with health and safety. We know that the virus transmission is through droplets during close, unprotected contact with an infected person by touching infected surfaces and then touching the nose, the eyes, or the mouth. So when we talk about RACE, the first step is recognize the hazards. So we need to recognize how people in your business come in contact or could come in contact with COVID-19, and then we need to take steps to minimize that contact. Once we've recognized what the hazard is, we need to assess that risk level. We need to assess the risk of infection. We need to assess the risk of credibility of our organization or our business. We also need to assess the risk of our financial viability. So when we're talking about risk, we're talking about if somebody came in contact with COVID-19 in your workplace, how bad would it be? What's the risk level to that person individually? And we have to assess that risk to determine those controls that we need to put in place. How will it affect your business? How will it affect those individuals? And how are we going to control those hazards? So when we look at this picture here, every single day, people are assessing the risk. We're driving down the road and we assess the risk that something is coming up in the middle of the road. Seems to look maybe like an animal or something there is on the road. And we assess that risk and determine how to maneuver around it. We slow down, we go around it. As we slow down, we look to make sure nothing else is coming when we make that decision to go around it, or whatever decision it is that you make when you're assessing that risk. So there can be very poor results to our decisions, and hopefully we're going to have the good results to our decisions. You may underestimate the risk, you may overestimate that risk. If you are indecisive about the risk, those lead to poor judgment, and those poor judgments can lead us to the wrong control potentially. So when we look at this picture, each of us assess that risk differently as to what this is and what we should do about it. But we need to get the facts. We have to know what it is in order to make a good decision. So in that picture, it wasn't in fact an animal. It was a pair of gloves on the side of the road or in the middle of the road. But our hasty observations and assumptions that we make can lead to overreaction. Potentially, it could lead to an underreaction as well. But we need to have the facts in order to make the proper decision. And that comes back to where I was saying at the beginning that it's really important to think about the facts and learn from the provincial government, from Health Canada, from your local public health unit. Once we've assessed our risks, we need to determine our controls. In health and safety, all controls are based on a hierarchy. So the more effective controls are at the top of that hierarchy. So elimination is the best control that we can do. Substitution, followed by engineering controls, followed by administrative controls, and then personal protective equipment being at the bottom of our hierarchy of controls. The effectiveness decreases as we move down that pyramid. So we're going to talk about with COVID-19, what different controls can we put in place to protect our workers? So a control is a measure that's taken to prevent the spread of COVID-19, and it should be done in compliance with requirements of legislation. So there are some legislations that are relevant to COVID-19, including the Occupational Health and Safety Regulations, the emergency orders made under the Emergency Management and Civil Protection Act. So just recently, the state of emergency has been extended, and with that as well, our emergency orders were extended as well. So it's really important that you look in to see what is the state of those orders at the time. As well, we have public health directions and guidance issued by the Ontario Medical Officer of Health and the Ministry of Health. So those are currently the legislations and the requirements that we're looking to when we're talking about COVID-19 and what we need to control. So the best control in that hierarchy of needs is elimination. As we're here today in a virtual meeting and training, we're doing well at elimination through virtual meetings. But with that, we need to train our workers and how to keep their surfaces clean and frequently touched equipment clean, whether they're at home or whether they're back into your office setting. We need to train our staff on how to wear and maintain any PPE that we determine later on is required. And we need to train our workers on how to communicate with customers in that virtual setting. So we're seeing more and more skill at this virtual level, but is there things that we need to consider as employers, including ergonomics for our staff who are now working from home? And are they working in a safe and comfortable environment, or are they working off the corner of their couch? And how can we make sure that they're working in an environment that is safe for them? So hands-on training may be required to ensure safety of your workers. And what does that mean? And how do we consider that hands-on training when we're looking at physical distancing? And it's certainly something that you'll have to identify within your business, whether it's something that we can train through administrative training or virtual training, or is it something that may require hands-on training as well? Another part of elimination is the use of electronic orders and curbside pickups. We're seeing more and more business successfully putting into place the ability for individuals to not enter into businesses as the public and be able to pick up their curbside orders. Part of this as well is screening employees and customers for COVID-19. Do you have a checklist that asks specific questions with regards to COVID-19 and symptoms that they may have and risk of exposure? You can find some of those checklists either on the provincial government's website or on our website with WSPS. We have some links to screening tools that you can use for public as well as for your employees. Another control for this is a separation. The implementation of a barrier device or a screen that is put in place between a worker and another worker or worker and the public. So we are seeing, again, more and more of these out in the public with businesses putting these into place that you should consider as you plan on opening your store. Is it at a front gate? Is there a barrier of some sort, a ticket window, or between the worker and the public, for example, at a cash register? Which goes into redesign. So is there a redesign that's needed within your business? Reconfiguring the lineups and the flow in and out of traffic. How do people move in and out and around your business? We're seeing the use of arrows on the ground, but also the reminder to public to use those arrows and to follow the redesign and the lineup methods that you're putting into place. With redesign also, we're looking at the adding of sanitized stations around organizations and businesses, making sure that there's warm water at sinks within your business so that hand washing can be adequate. Putting increase of garbage cans available, and with that, the increase of sanitization for emptying those garbage cans. As well, debit and credit tap capability are allowing that redesign so that the contact within individuals is decreased. So those were our elimination controls, and now let's talk about some administrative controls. It's important at this point to update your health and safety policies. So all businesses in Ontario should have a policy with regards to health and safety, and now would be a very important time to review that policy and update it to include information about safe work procedures, including physical distancing, where possible, workers are encouraged to keep a minimum of 2 meters between themselves and other workers and members of the public. Not packing in reusable bags, potentially. Again, looking at that risk. This is something that we've seen actually change in the last day, that some businesses are now allowing reusable bags. So determining based on your risk whether or not that is an acceptable procedure in your workplace. Limiting the number of people in vehicles. So if you're a business who has staff transporting together in a vehicle, how do you do that safely? Do you limit the number of people within a vehicle? Do you have groups of people who always travel together? in one vehicle, trying to limit the exposure to others. As well as what are your cleaning practices and frequencies. You need to determine what you're doing now and what you need to increase it to going forward. Administrative controls also require updating your PPE, your personal protective equipment. What are the requirements? What's the supply? What is the replacement? What is the training around that PPE, and do our staff know how to use it safely and properly? You may need to update your first aid procedures and your emergency response procedures as they relate to COVID-19. And we're seeing a definite increase in workplace harassment. So please make sure that you're updating your health and safety policies around workplace harassment and ensuring that they're current and up to date, and that you as an organization know how to respond to your own policies with regards to workplace harassment. An additional administrative control is your human resources policy. Will you be implementing screening of your staff? Pre-start screening, daily screening? Will you be looking at some sort of isolation of your workers? What about return to work policies and medical privacy? So those are things that as a human resources program, you need to review those policies to make sure that what you're requesting fits within your policies as well as within legislation. Another administrative control that is, I think, where we're starting to see more people start to look at is scheduling. Within offices, what do our office hours look like? What are your store hours look like? What are your staffing levels? If it's an office setting, do all staff need to be in at the same time? Can we have rotating schedules? Can some people work different shifts than others? And with that, what does the cleaning and sanitization process look like between staff, changeover in staff, breaks, lunch, making sure that we're addressing all of those times and those high touch areas when we may have staffing changes due to scheduling. An increase in signage to remind people to follow physical distancing procedures. Reminding people to hand wash and sanitizing. You may have signage with regards to harassment that it will not be tolerated in your workplace. As well, we're seeing some shirts out there that people are wearing, shirts that cross their back that says, please don't forget physical distancing. You know, let's stay close together by being far apart. So you may look to have that written on some of your staff shirts as they're out in the public to remind people to maintain that physical distance. And finally, an administrative control around hygiene. Hand washing or sanitizing, coughing and sneezing, as well as airflow with your doors and windows open or closed. Hygiene with regards to cell phones and two-way radios as well. What is the cleaning procedure that's happening when those cell phones or two-way radios are switching hands, and making sure that we're following those procedures to make sure those very high-touch technology devices are being cleaned down. As well, do you have hygiene policies and processes around washing of clothes? Do your staff have to change at work? Do they change when they get home? And ensuring that their clothes are cleaned. If you are a business who provides one shirt to your workers, maybe this is a season that you might want to look at increasing that because of COVID-19 and wanting to increase our staff changing and washing of those clothes. So that's something to consider when you're looking at all of your processes. Is that something that now needs to be considered in order to allow the increase of sanitization? So some administrative controls. We didn't talk about the mental health side of this, but it's really important that you do consider the mental health of your workers, the stress of returning to work, thinking about their transportation to and from work, the stress of what's happening at home, those who have young children at home, are they working from home with those young children, and how is that going? If they're not used to working from home, all of those sorts of things. So you can look for resources within WSPS.ca, as well as thinkmentalhealth.ca. Other great resources that we talked about looking for is your local public health unit, Health Canada, municipal and township bylaw departments, the police, the provincial government, and those sorts of resources to ensure that you're looking at the most adequate, accurate, and complete information. So finally, in that hierarchy of control, we land at PPE. So PPE being at the bottom of our triangle, and it is the least effective control when we could have eliminated or had administrative controls. So PPE is still important to consider, but it's not our first control that we should be looking at. So when we talk about PPE, the first thing that we often talk about is the face. So there are different face device coverings that can be used. And as an organization, it's important that you determine which ones are appropriate for your workers. There is no one-size-fits-all decision about what should be worn and when. So there are the N95 respirators versus a cloth face covering. Which one is right for your organization will depend on the type of work you're doing and the exposure and the risk assessment that you have done to determine what is needed for your workers. You also, when we're looking at the face, we have face shields or goggles. So a face shield covering the full face versus a goggles covering the eyes. Again, a determination in your workplace that you must make about what's required for your workers. Hands, when we talk about our hands, is there a need for gloves? Or is it an increase again in hand washing and sanitization? Body, we have aprons. But what's really important is regardless of the PPE that you determine is proper training, fit, use, care, cleaning, replacement, and the limitations of that PPE. As a business, if you put in a PPE as a control to a hazard, you must ensure that your staff are knowledgeable and trained on its use, its limitations, and how to care for it. You can find that information at www.ontario.ca/PPE. Also at that website, there is a link to a website that the government has created to help you source out PPE. If you're looking for PPE and cannot find it, then this website is available for you to click on to source out the PPE that's required for you. Finally, once we have put in controls, it's very important that we evaluate the effectiveness of the controls that we have chosen. So it's not enough to just put a control into place and think that we have met all of our needs and requirements as an organization. You need to look at the effectiveness of that preventative measure on an ongoing basis. You need to ensure that that control is not creating new hazards along the way. You need to make adjustments based on what you have learned and improvements, and you must continue to communicate with your staff and customers those changes to ensure everyone understands the controls that are being in place to protect the safety of your workers. So while this is going on, there are inspectors who are and continue to be out in the community helping businesses with regards to health and safety. Just because COVID has come into place doesn't mean all of the other health and safety knowledge that we have goes out the window. We have to continue to protect our workers every day. As I said at the very beginning, every worker healthy and safe every single day. So when we speak of inspectors, we're talking about inspectors from the Ministry of Labor, Training and Skills Development, so the MLTSD. Formerly, you might have thought of them as the MOL, but they are now the Ministry of Labor, Training and Skills Development. So inspectors may focus on things like how many workers are working together, what screening the employer has in place to prevent workers who may have come in contact with COVID-19 from coming to work. Do you have a screening process before your workers come to work to ensure that they have not come in contact with COVID-19? Inspectors may be looking at policies and procedures that are in place with regards to workers who have developed symptoms. What's your process for those people who have developed symptoms and the need to stay home and ensure they are not coming into the workplace? How the employer is ensuring physical distancing, that 2-meter separation between workers. So we do still need to maintain that physical distancing amongst our workers. How is the employer ensuring proper on-site hygiene? as well as other precautions, including the use of PPE, may be things that inspectors are looking for. The other people that we may see in workplaces is by law enforcement officers who may be called to look at some of those things with regards to COVID-19 physical distancing within workplaces as well. So while this is going on, Health and Ministry of Labor Training and Skills Development inspectors will continue to enforce the Occupational Health and Safety Act. So that is still the act and the regulations required to your businesses to ensure that you are following. They will continue to look at health and safety awareness training. This is mandatory training that all workers in Ontario must complete. It takes approximately 1 hour to complete that training, and it is mandatory within the province of Ontario for all workers to have. They will continue to look at WMIS, especially when we think about the increase of cleaning. Have you changed the products that you're cleaning with? And if you have you ensured that all of your staff are trained with the use of those products? We'll continue to look at machine guarding, making sure that your machines are safe and properly guarded, as well as safe work practices, your joint health and safety committee, monthly inspections, or health and safety reps, depending on the size of your business, and any other applicable legal requirements. WSPS has created some very, very, very beneficial resources for you that can be found at WSPS.ca, including a pandemic recovery return to business checklist. If you are returning to business, please check out this checklist to help you determine your needs for your business. We have a post-pandemic playbook that outlines step-by-step what you need to do for the resumption of your work. We have visitor screening questionnaires and COVID-related health and safety guidance documents that we've been hearing about in the news from the government, as well as from trade associations and organizations. So please look at these guidance documents that are very, very specific to different businesses and organizations. We have a duty consultant at WSPS who works Monday to Friday from 7 a.m. to 7 p.m. That duty consultant is available to ask any questions on the spot when you require an answer. You need something or you need to know, is this an issue for your organization? Then you're able to contact our duty consultant directly for that information. WSPS has staff across the province of Ontario, health and safety consultants who are available to support you. You can contact them by finding us at WSPS.ca, reaching out to TTC Canada directly, who I can work with to make sure that we're finding you the health and safety consultant local to you so that we can continue to support you as you return to work from COVID-19. So I thank you very much. I hope that you found this information beneficial. I highly encourage you to continue to look for resources and changes as we progress through this pandemic. I hope that you're all healthy and safe. And is there any questions that came in?
I'll just give people a couple seconds here if they have any questions, just to compile their thoughts, because that was a lot of really good information, Pam. And I think the one thing that really strikes me, which I wasn't thinking about prior, was the fact that the simple things like using protective gear is something that people still need to be trained on. Something as simple as putting a mask on, wearing gloves. It's not something that crosses your mind as a training thing. You know what I mean?
Absolutely. And as a business, you are required to train your staff in the use of PPE. So if you say that I would like you to wear a mask, well, how do we train them on how to put that mask on, and when does it have to be cleaned? So we have to consider that as businesses as well. Not as simple as saying, please do it.
No, and I think that kind of goes for a lot of things in business where you can't just expect people to know. You have to be able to tell them, this is how you're supposed to work and here's what the expectation is. But especially when it comes to something as simple as wearing masks, it's really important to make sure people know that you have to cover your nose with it, or the little things. I love when I see people and they've got it down here and you're like, it's not how it works.
It's not how it works.
Well, it looks like you did a really good job explaining to everybody because we don't have any questions. However, if anybody who is watching does have questions later on, feel free to reach out to us. I'm sure Pam, if that's okay, would be
Please.
able to answer any questions that you have. So we will be posting this recording up for everybody on our YouTube page as well as on our social media platforms, and we'll link all the information there for you so that you can get in touch if you need it. But Pam, thank you so much for taking the time. Really, really great information for us.
Terrific. Thank you very much.
Thanks. Have a great day.
You too.
Bye.